Right now, are you happy with current situation of COVID-19 in Thailand?
Of course I am.
I'm glad to hear that.
Yeah.
Yeah. Dr. Tanarak, I'm not sure whether you had a chance to listen to the 5 days of House debate on the government's stimulus spending package or not. But in summary, all the politicians who spoke expressed their appreciation for medical personnel in the fight against the success in the fight against the coronavirus. But there are a number of opposition MPs who have very strong reservations about some of the stringent measures that have been introduced and are still in effect. For example, the continuing closing of schools, the curfews, and the state of emergency. Do you have any reaction to that?
Yes, of course. I think the situation at the moment, we are doing very well. We have very few cases that is local transmission. But still, I believe that we still have to be very careful. When we reopen too soon, there can be some problem and we have to reclose again. That is not something that we want. What we are trying to consider to do at the moment is that what is our priority? So far, I believe that we have been open a lot of business, a lot of places that is necessary for everybody. I can understand that there are still some places that they cannot really open to operate their full business, but they can still partially do something. For example, if we talking about the nightclub or places that we can go out and have some drink, although they cannot open and have someone to come in and drink inside, but they can still sell some alcoholic beverage. That can be partially open. I would say that, although it will not help the business to be able to operate at the full as good as they can. But I think at the time, I think we are reasonable enough. We have seen so many examples from other countries, so we have to be very cautious, and steps have to be taken, and we have to consider what is our priority, what is the most important things. For example, we are now discussing about the reopen of the school. We give a prioritization to the priority to the school, so that we would like to see the school reopen before some other high risk business to be reopened. And we already apply or sent our recommendation to the office of the Prime Minister.
Yeah. And with the Songkran holidays, probably the government is going to consider having extra Songkran for people during July. Do you think it's a bit too soon for Water Splash Festival in July?
I would say that what the government is consider, I believe it is the holidays to replace those Songkran holidays. But I haven't seen they haven't said anything about the celebration or other festival that they're planning. But I still think that having people giving them a holiday so that they can do something is good. But having a mass gatherings in July may not be a very good idea. I still think that if still people want to have Songkran like festival in July, I believe that we can still have it, but not in the way that we used to have it. We can have a celebration within our families. We can visit our families members, the one who we respect, and give them our respect, having water ceremonies, those kind of things. I think that would be great. That I'm not looking forward for a mass gathering event like what we used to have in certain areas in Bangkok or in other provinces. Um, we can have a small but meaningful Songkran.
And today, during the press briefing, there is concern raised by Disease Control Department that wearing face mask alone perhaps not enough or will not help in the prevention of contagion. So you mean wearing face mask is not enough?
No. I think we said face shield, not face mask.
Okay.
Because recently we have seen a lot of people coming out of their household, going to shopping, going and do their own business, wearing only face shield. That is not adequate. It cannot prevent if the person is infected, it cannot help prevent the disease to spread to the others. Or if there is someone very close to them is infected, the face shield will not help them preventing the disease that they get the disease. So we recommend that the face mask should be wear, and if they would like to wear a face shield, that's good, but only face shield is not enough.
So it means if we want to wear face shield, we have to wear face mask at the same time.
Yes, that's right.
Yes.
Dr. Tanarak, the 1 trillion baht borrowing royal decree has been passed among the 3 decrees, right? And the government intends to use part of the budget to help finance the boosting of the healthcare system in Thailand. So in the aftermath of the coronavirus, do you have any advice as to how the money should be spent in boosting the healthcare system? Because doctors are now the heroes of the society, so you can ask for everything now, and no one will object to that.
Actually, what we got is not that much. Most of the budget will go to support the business, to the affected population and businesses. What we will get is just not very much, but I think that is enough if we plan it carefully. I would like to say that, as I mentioned, that although we have done quite a very good job, but there are still a lot of things that we can do, or we can do better. I would say that our spending should be on the preparation for the next epidemic, no matter what diseases it should be. It may be the COVID return on the second wave, or it can be other pandemics that we surely will face in our lifetime. I'm not sure that it will be worse or easier to handle than this one. But we still have to be prepared for that. If you look back in the last 10 or 15 years since we have SARS in 2003, we can see that we have so many diseases threat. From SARS, from avian influenza to H1N1 pandemic in 2009. We have MERS in 2012, and then we have other kind of avian influenza, H5N1, H7N9. So many things that threat our securities. So although we score very well on global health securities, I think you all know that we score very high in the Global Health Security Index research by Johns Hopkins Universities. Yeah. But if you read carefully, but Johns Hopkins University report said that there is no countries really prepare for pandemics. And this one already showed us that we did not really, we prepare very well, but when the pandemic hits us, it still taught us a lot of things that we have to learn from them and have to improve. There are so many things that we can do. Other countries, for example, Singapore or Hong Kong, after the epidemics of SARS, they have a very large institute of infectious diseases. that can take care of more than 200 patients. Our infectious institute, the largest one, is Bamrat Naradun Hospital, can host only 80 patients. We have to expand those capacity in order to handle a large pandemic. So that is one thing. And it is not just one single hospital that can work for us. We still have to have this kind of institution on other region as well. There are some hospitals that already consider about being excellent centers for infectious diseases. We welcome those ideas, and we still need a few more. So those preparation for caring of the patient is very, very important. There are so many other considerations that we can invest on. For example, our emergency operation system, or someone call it emergency operation centers. We are using it to its full potential. But if you ask me, are we good enough? If we can we benchmark with others? We are still very far from the best, and we still have to work on that. At some point in time, our system doesn't run very well. So there are a lot of things that we have to train, we have to learn, and we have to improve, as well as so many other things. Our data analytics is still very slow, not real time like what we hope that we would have on these times. Other surveillance system need to be improved. Those are what we call the work on global health securities agendas. There are also other things. Also, for example, port of entries. Our airport have to improve in terms of health securities. So if we look at all the areas that we have to work on, there are countless, I think. But still, we know what is our priorities, and we want to work on that, and so that we can prepare well enough for the next threat that will come.
So there's still a lot more to do, Dr. Tanarak.
Excuse me?
So there's still a lot more to do in the all right.
That's right.
Yeah.
That's
So
right.
Dr. Tanarak, during the House session last week, all the MPs, both government and opposition, spoke very highly of the role played by the village health volunteers for their contribution in helping fighting the pandemics. So how do you see the future of these volunteers, especially with the lessons learned from this pandemic?
I think they help us quite a lot, and that cannot be said enough. They work very well, and they have done quite a very good job. They help us on several fronts, not just doing quarantine. They identify a person coming in. They help us with health education, with risk communication. So they are doing quite a lot, and I see their values. What we at the Department of Disease Control and Ministry of Public Health would like to do in the next phase is that we would like to arm them with our digital technologies, so that they can help us even more with those high-tech tools that we can have them use them. So I think this would be also a very good plan for our laying down our fundamental work on our health volunteers.
Yeah. And Dr. Tanarak, right now, many people have concern whether Thailand will face second wave of the outbreak of coronavirus. What's your assessment?
Last time I was asked this question, I would say that the reporter should not ask me. The reporter should ask this question to all Thai people. And it is very important for them to understand that what they will do will have an effect on the futures. If they let their guard down, if they are not very careful, if they go out without their face mask, they have a mass gathering event, they go out and bring with their friends, not be very careful. Then the answer is that, well, yes, of course, we may have the second wave. But if everybody is very careful with their lifestyle, if they still practice social distancing, they wash their hands frequently, they wear face masks wherever they go, and they be very careful going outside, then I would say that it is less likely that we will have second wave. It is not all or none. It should be the gradient of risk from very low risk to very high risk. So it's depending on how we behave in the next few weeks or next few months. That should be a good answer to whether we are going to have second wave or not. So I'm waiting to hear what Thai people will answer to your question.
So they have to do their part if they don't want to see a second wave.
Just like Lord Buddha used to teach us, what we will do now will determine what will happen in the future.